of the Institute for Global Tobacco Control at the Johns Hopkins Bloomberg School of Public Health. And I'm really excited to introduce this month's speaker for our Innovations in Global Tobacco Control seminar series. So today's speaker is Dr. Joaquin Barnoya. He is Director of Research and Education at the Cardiovascular Surgery Unit of Guatemala and a research associate at the Institute for Research and Superior Studies in Health Sciences at Landavara University, also in Guatemala. Dr. Barnoya's research focuses on tobacco and obesity control from a population-based perspective. And he has focused his career so far on tobacco and food marketing, including packaging. He's also, in the past, analyzed tobacco industry documents to explore tobacco industry interference strategies. And he has collaborated with one of our former colleagues at Hopkins, Dr. Ana Navas-Acien, who was at the, in the Department of Environmental Health, now the Department of Environmental Health and Engineering. Dr. Barnoya also has longstanding interests in training and mentorship. And that's how I met him many years ago with, through those common interests. Dr. Barnoya's work has been recognized through a number of awards. He's received the World No Tobacco Day Award from the World Health Organization for his outstanding contribution to tobacco control a few years ago. He received the Third World Academy of Sciences Young Scientist Award from the National Council of Science and Technology. He's received the Rising Star in Cancer Research Award from NCI's Latino Network. And he was recognized by the American Heart Association for one of the top 10 scientific contributions of 2005. And that was based on a paper he published in Circulation in the journal Circulation on the cardiovascular effects of secondhand smoke. And that research was so important at that time to sort of continue to pave the way for smoke-free policies around the world. Dr. Barnoya received his medical degree from San Carlos University of Guatemala, and he did his master's in public health from the Harvard School of Public Health. He then completed postdoctoral fellowships at the Department of Nutrition at the Harvard School of Public Health and at the Center for Tobacco Control Research and Education at the University of California, San Francisco. And I also have the pleasure of talking with Dr. Barnoya every few weeks as, given that we're both senior editors of the journal Tobacco Control. So without further ado, I'd like to hand it over to Dr. Barnoya to talk about the emerging tobacco product market in Guatemala. So Joaquin, thanks for joining us, and over to you.
Thank you, Joanna, for the kind introduction. Thank you all for virtually joining me. This was certainly interesting or uncertain times, but I think we'll have something to learn and to share at this moment. First of all, I have no conflict of interest to declare. A brief overview of what I'm going to go through. First of all, I'm going to talk a little bit about the smoking prevalence in Guatemala. Briefly mention of the FCTC. I realized that some of them in the audience, some people in the audience might not be familiar with what the Framework Convention on Tobacco Control is. So I'll just give a brief overview of what's the status and what's going on in Guatemala, and then focus on the two new products that we're talking about it, and probably what we have identified as the main marketing strategy the industry is using to reach consumers, and then I'll close with some conclusions and hopefully leave some time for Q&A. So unfortunately, Guatemala lacks a formal or standardized continuous survey to assess how the tobacco epidemic has been evolving in the country. There are isolated efforts to get the smoking prevalence. The most recent one was the Global Youth Tobacco Survey that was conducted about 5 years ago. For those of you who are not familiar, this is run by the CDC in the US with a standardized questionnaire worldwide. And it includes a convenient sample of adolescents going to school ranging from the age of 13 to 15. And they found about a 20% smoking prevalence among males, not that much higher compared to females, which they found at 13%. Then we have the STEPS, which is also a WHO-run survey on chronic disease risk factors that was conducted in 2015 as well, with a sample of 2,000 adults in the metropolitan area of Guatemala. That's mainly Guatemala City. And they found a little bit higher of a prevalence among males, yet considerably lower smoking prevalence among females. I think data from STEPS is probably more likely to reflect what's going on in the general population, where smoking prevalence among males is considerably higher compared to females. Similar to what has been documented elsewhere, the age of initiation is in their teen years. It's a little bit later than what other countries have found. And something that has been documented in the US among Latinos is that even though the smoking prevalence could be higher, the smoking intensity is lower. And we found that they found that smoking intensity in Guatemala is about around 6 cigarettes per day. In other specific survey, just among sugarcane cutters, they found a 15% smoking prevalence. And we know that smoking is a risk factor for chronic kidney disease, which has been identified as an epidemic in all the Mesoamerican regions. So this is one of the hypotheses on why we're finding such a high rate of chronic kidney disease in this workers' population. What we do know is that Guatemala is one of the largest consumers of capsule cigarettes in the continent, just below Chile and Peru. About a third of the market in Guatemala is for capsule cigarettes. And for those of you who are not familiar, these are just, you see the traditional cigarette stick, but in the filter it has a capsule that once the smoker presses, it will change the flavor of the smoke. This is something that has been recognized by the industry as a novel approach to reaching consumers. And you can read this quote from the tobacco industry, that this segment gives them the capacity not only to retain consumers, but in some cases, such as Mexico, to attack consumers back from illicit trade, but also to address wider consumer trends, such as those that desire for customizability. So as I said, this is the traditional cigarette stick. And in the filter, as you can see there, it has a little capsule that when the smoker will press it, it will change the flavor of the smoke. This is also data from the US, where you can see that regardless of age, Latinos are consuming a much higher amount of capsule cigarettes compared to the other race and ethnic groups in the US. It's compared to whites and blacks, where you can see across age, it's more likely to be consumed by Latinos. So there's something about capsule cigarettes that is attracting Latinos both in the US and in Guatemala and elsewhere in Latin America. This is how the cigarette packs looks nowadays. This is from Lucky Strike. This picture I took in Guatemala not long ago. And you can see that it has 4 different colors in the pack, which means that the blue would correspond to menthol, the green to tropical fruits, the orange would correspond to licorice cream, and the red will correspond to fruits in general. So each pack, or each one of these Lucky Strike packs will have 4 different flavors that the smoker can choose to inhale if they want to change the flavor of the smoke. I'm gonna get back to this type of advertising later on my presentation. So the Framework Convention on Tobacco Control is the first worldwide public health treaty that was evidence-based public health treaty, if I might say, that was convened by the WHO around, it's been more than 15 years by now, time goes by. And it includes several strategies or articles that signatories and countries that ratify the treaty must abide in order to control the tobacco epidemic. Now, I had to say that even though these are the the steps that any country has to comply to reduce tobacco smoking and to halt the tobacco epidemic, there's actually no consequence if a country fails to comply with the FCTC. And even though, as you can read there, Guatemala signed and ratified the FCTC 15 years ago, only one of the articles has been implemented, which is protection from secondhand smoke exposure through the implementation of smoke-free environments. Unfortunately, even though one thing is passing a law, the other thing is implementing it and then enforcing it. And this is data that we collected before the law in 2006, then 6 months after the law in 2009, and ultimately 5 years after the law was implemented in 2014. And this is data only from bars and restaurants. You can see bars in the blue box and restaurants in the green box. And as you can see here, before the law, exposure to nicotine was very high, particularly in bars, and it was high as well in restaurants. This is airborne nicotine, by the way. Then 6 months after the law, you could see a significant decrease in nicotine levels at the bars and the restaurant, and the drop was particularly significant at the bars. However, due to lack of enforcement, 5 years after the law was implemented, you could see levels in bars starting to go up, not so much in restaurants, but in bars, it was particularly noteworthy that the law was starting to fade given the lack of enforcement. Now, you can always talk that how would this be translated into public health? So back in the days, during the 2010 Soccer World Cup, a research team was always going to go and watch the soccer matches, which I would not tell my fellows not to do it. So I said, okay, so while you're watching the game, do me a favor and just watch during the 90 minutes of the soccer game, how many times you see a customer violating the law or the venue not abiding to the law. And we came up with this number, which is what you see in your far right, which is the amount of money in Guatemalan currency, which is outside of the parentheses, and inside the parentheses, how much money the government would have made if just during the month of the Soccer World Cup, they would have sent inspectors or supervisors to guarantee that the law was being implemented. So in just 1 month, a total of $90,000 would have been collected if the Ministry of Health would have sent 9 inspectors just in Guatemala City to make sure that the law was being implemented. So again, as I said, it's one thing getting a law passed and implemented, but a good law with no implementation and enforcement could just be just as bad as no law at all. Another part of the FCTC that Guatemala includes in the law but has not been enforced is a ban on single cigarette sales. Even though these have been banned way before the FCTC came into place in 2005, we surveyed about 400 street vendors in Guatemala City, and we found that most of them sell cigarettes, single cigarettes, which is a strategy that the tobacco industry uses to reach poor consumers in particular. And the brands that they were selling were both from Philip Morris and British American Tobacco, but these are the brands that target the low SES groups in particular. So another part where even though we have a good law, the lack of enforcement pretty much that we have no law at all. Another part of the SCTC that Guatemala is failing to comply is access to smoking cessation medications. And this is particularly relevant nowadays that we know that smokers are at a high risk of a COVID infection and mortality. And several countries are making very big efforts to encourage smokers to use this as an opportunity to quit smoking, not only because they will decrease the risk of coronavirus disease, but also because of all the health benefits that they will accrue while quitting smoking. So what we found here is that if you were to look for smoking cessation medications, in that time, which is almost 10 years ago, a smoker would have to visit 4 pharmacies in order to find one smoking cessation medication. And if they were to find one, it is very expensive considering the minimum wage in Guatemala. And it's very much expensive compared to continuing smoking, which is about $2 per pack in Guatemala. So smoking cessation is not only hard to access, but if they will get access to it, it's gonna be unaffordable, making it even harder for someone who's trying to quit. So now I'm going to talk briefly about the policy scenario around emerging tobacco products. And you see this on your far left, you're going to see the policy. Then the next columns are the policies that are implemented for cigarettes. Then the next column is for e-cigarettes, and the other one is for HTPs, which stands for heated tobacco products. These are new products that the industry has been working for over 10 years now. And it's pretty, I could say this is the tobacco industry's dream, to generate a non-combustible product. So heated tobacco products, as opposed to burning tobacco, what they do is they heat it up at lower temperatures, so will still release a vapor, but they claim that most of the toxics and carcinogens will not be released as the temperature is not going as high. In Guatemala, the only one available is Philip Morris IQOS, which I will talk later on in my presentation. So you see that there is a minimum age law for cigarettes, even though there is no compliance with the law either. There's no restriction on sales. And the marketing of the cigarettes, of the conventional cigarettes, we do not have a law complying with the FCTC. The industry, foreseeing what could happen, they self-regulated themselves and remove advertising from television, radio, and billboards. But they kept the other very effective advertising, which is point of sale advertising, which I will talk later on as well. There are no regulation packaging, product regulation, reporting notification, the clean air, the smoke-free laws, as I said, yes, it's the only one that Guatemala has, but unfortunately, as you saw before, it is not being enforced, and we have no specific cigarette taxes. The same applies for e-cigarettes and heated tobacco products. So here you can see how you have 3 products on an unregulated market. Unfortunately, we have the FCTC, which would have given us the opportunity to regulate cigarettes and capsule cigarettes, but due to lack of political will, we have not moved forward with the FCTC implementation. So I'm going to focus on e-cigarettes before I talk about heated tobacco products. There's a wide range of e-cigs policies around the world, and I don't think there has been one country who has figured it out. So right there you see Guatemala, where we have no regulation whatsoever, but up north you find Mexico, where apparently it's banned. And currently we're working with Jim Thrasher and our colleagues at the Instituto Nacional de Salud Pública in Mexico to compare both countries on how you can have a country with no regulation whatsoever, with a high prevalence of e-cig use, compared to another one where e-cigarettes are supposedly banned. However, consumption is also high, because you can buy them in kiosks, you can buy them through the internet. So again, as I said, it's not really clear how we regulate e-cigarettes on the basis of which health consequences we do it. Given the recent EVALI or lung disease that has emerged in the US, this could give us even better ground to ban e-cigarettes or to better regulate them. What are electronic cigarettes? For those in the audience that are not very familiar with them, are vaporizers that, again, have a battery that will heat the liquid. Some of them contain nicotine, some of them will not contain nicotine, and generate this big amount of vapor that the users, the vapor as they're called, will inhale. Unfortunately, thus far, we have no standard of fabrication or marketing, neither one for labeling. So it's very hard to find out what's in the e-cigarette or the e-liquid, including toxic components, which lead us to a lack of warnings as well. In Guatemala, the survey we did in 2015, where we went to pharmacies looking for smoking cessation medications, we found that approximately 1% of pharmacies were selling e-cigarettes. This is likely to have gone up 5 years later. We do have evidence that they're being used in bars and restaurants as a loophole to the smoke-free laws that unfortunately does not include e-cigarettes because they were not available at the time when the law was drafted. And preliminary data has yielded that about 6% of males and females are using e-cigarettes. And I'm gonna get back later to this number, because fortunately now we have a good sample size of adolescents that have responded to the question about e-cigarette consumption in Guatemala. Thus far, 3 generations have been identified of e-cigarettes, But again, it's such a fast changing market that you can have more generations, not only these three types, and the fancier they get, the more expensive they are. Some of them are disposable, some of them are rechargeable, some of them have rechargeable e-liquids, some of them don't. So it's really an interesting market that is evolving rapidly. And it's hard also to generate evidence given that it's not one product, but rather they're different products. Where can you get them in Guatemala? Well, you can get them in pharmacies, you can get them through the internet, you can get them in supermarkets, in kiosks, in gas stations, and through local individual distributors. In Guatemala, you do not need a license to sell e-cigarettes. And as I said before, they're not taxed, they do not have a specific tax on e-cigarettes either. About 3 years ago, with my colleagues here in Guatemala, we went to supermarkets, kiosks, and pharmacies and purchased a sample of electronic cigarettes. And we found all of the three generations. Obviously, the higher generation, the more expensive the products were, and they ranged from $10 to around $100. And as I said, the third generations are usually rechargeable, and you can buy refillable e-liquids. We also purchased close to 50 e-liquids, and we found e-liquids in the cartridge as well as refills, and price ranging as well from about $15 to $10. Now, one of the arguments that the industry has made, and when I say industry here, I mean the vaping industry, but the tobacco industry as well, as they own some e-cigarette companies now, is that they're marketing electronic cigarettes as a smoking cessation strategy. Now, there's mixed evidence about the success of using e-cigarettes for smoking cessation, but regardless what you can see, the flavors that you find, I treat patients who want to quit smoking, and thus far, not one of them has told me that they want to quit because they want a fruit flavor or menthol flavor. Most of them want to quit because they're tired of the product. But when you see what flavors on e-cigs and liquids are being advertised, this is definitely not targeting current smokers, but are likely targeting young adolescents who are willing to experiment with this new product. As you can see in the graph, most of what we found was for fruit, menthol, and tobacco, and then even some interesting flavors such as desserts, alcohol, or cinnamon. And our colleagues in Mexico had found also some interesting flavors such as a jalapeno with bacon. So you can find them in a wide range of flavor, which again, I don't think they're targeting current smokers, but young adolescent smokers who are willing to experiment with these new products. With this same sample, what we notice as well is that the labeling is usually misleading. And as you can see at the bottom of this diagram, more than 2/3 of the e-cigarettes did not have, about a third of the e-cigarettes available did not have any nicotine reported. When you look on the other side, it was around the same percentage, about a third of the e-liquids that they were lacking any information on nicotine. So this is also telling you about how little we know about the product and how difficult it is to regulate on the basis of nicotine itself. Now, as I said before, we don't know exactly thus far we haven't any data. We didn't have any data on the actual e-cigarette use in Guatemala. So with our colleagues in University of South Carolina, Jim Thrasher, we got some funding from an NIH with the R01 grant to do a survey among adolescents in private schools in Guatemala to assess the use of cigarettes, capsule cigarettes, electronic cigarettes, and heated tobacco products. So we went out to 8 private schools in Guatemala, and we surveyed about 3,000 adolescents, and this is what we found. The mean age was around 13 years, but when you see the current e-cigarette use, it's about a third of adolescents that are using e-cigarettes. But when you look further down in the red, when you see the current cigarette smoker, it's a threefold difference between those that are smoking cigarettes compared to those that are using electronic cigarettes. And if you look further down in red as well, we also try to assess where are they getting exposed to this advertising for electronic cigarettes. And it's not that much through the internet, which is, there's mixed evidence about where is this advertising coming from. What is interesting, it's that nearly 70% of those of the adolescents surveyed had a friend who was using an e-cigarette. So it's probably something that adolescents are using in groups. Consumption patterns are very different when they are from tobacco, because a cigarette, once you light it, you have to consume it totally or throw it away, as opposed to a cigarette where you could share around with your friends. So I think the bottom line in this line, it's about a third of young adolescents in Guatemala City are using these products. I need to highlight that these are students in private schools in Guatemala, which means that their SES is the socioeconomic status is probably on the middle to the high SES, which makes sense when considering the price of the e-cigarettes that I showed you in a few slides before. So this is just some preliminary analysis that one of my colleagues, Jose Monzon, is doing. What is it that is increasing the odds of e-cigarette use among these adolescents? And I just highlighted some of the highest, some of the variables that increase the odds the highest among our sample. And you can see that those who were current smoker have nearly a 12-fold increased odds of using an e-cigarette. And this probably talks to the fact that these are dual users. It could be that they're using the e-cigarettes to circumvent or to find a loophole to the smoke-free law. It's also associated with binge drinking. And again, you can see that those that have a friend who's using the e-cigarettes also have 5-fold higher odds of using e-cigarettes compared to those with no friend using e-cigarettes. I need to highlight, in the interest of time, I'm not going to go through each one of them, but these are not very different to what you would find for the odds of smoking in adolescents as well. So we could say that there are similar predictors for using e-cigarettes as they are for smoking. Yet the prevalence of e-cigarette is considerably higher compared to cigarette smoking. Now I'm going to switch with the next 5 to 10 minutes on the other emerging tobacco product, which is the IQOS. Well, I thought it meant I quit ordinary smoking, which is kind of interesting because that would be the industry saying that smoking is ordinary. But I have had some conversations with Joanna lately, and we're not very sure what IQOS stands for. This is just from the website of Philip Morris Guatemala, where you could see it's a very fancy product, very technologically savvy product, and it's just like going to a Mac store. Where are IQOS available so far? The EU in most of the countries, some in Russia, in Latin America, only in Colombia and Curacao in South America, in Central America, only in Guatemala, in Mexico, and in the US, they have just been approved last year. Joanna can correct me if I'm wrong, and I think it's only 1 or 2 cities. I think Atlanta is providing them, and then in Canada. And they're going through regulatory issues on taxes and so on and so forth. In Guatemala, they're totally legal. Where can you find them? First of all, they have an IQOS store in a fancy mall here. You go there and literally it's just like walking into an Apple store. I sent in my wife just for the trial, and she was totally impressed. She got offered a cappuccino. They asked her for her email, and then they sat her down and they went through the whole spiel about this. First of all, they say this is a Philip Morris product. They're not hiding it. They're actually saying that this is a huge success, and this is the future of the tobacco, the Philip Morris, that they want to switch away from the conventional combustible burning cigarette to this healthy option for tobacco consumption. But you can also find them in kiosks, like the one you see on your down right. This is out of the supermarket, and so the store minors are not allowed to come in, as opposed to in the kiosk. If you approach the kiosk and you're with a child or a teenager, they will ask you, excuse me, they cannot get near the kiosk. This is only for adults. I don't know how exactly that can be enforced, but this is what they have. How also they get it, they sell it? Well, they organize IQOS event. And this is one of the events one of my fellows went to, Jose Pineta. And again, very fancy, targeting young adults, technologically savvy adults. You can see they're having the drinks, and they can also sell them, by the way. So I could become a distributor of IQOS or the heats. The heats are the little boxes that you see in the middle of the slide, which are they don't come in different colors. They come in different, they don't come in different flavors. They come in different colors. But each color will correspond to a specific flavor. And I think this is the industry playing ahead of the curve, saying if you want to blend flavors, sure, go ahead, but we're not advertising flavors, we're advertising color. But again, I think the point here is how they're targeting the young adults. They want to target those that are either consuming cigarettes or those that want to experience with nicotine, considering that this is a healthy type of product that Philip Morris is introducing. You can see down there says this changes everything. This is in Guatemala, by the way, but it's all in English, very fancy. It's looks like a disco. So using the same sample of adolescents in private schools in Guatemala that we surveyed last year, here you can see in preliminary data analysis that Anna Gottslich with my colleagues here in Guatemala and in South Carolina with James Thrasher have done. And you see that about half of the respondents of the adolescents were very aware of the heated tobacco product of the IQOS in Guatemala. However, only about 3% are using it. And when you see further down, about 2 lines down, it says of every users of tobacco, which first tobacco product they use. So we have cigarettes, e-cigarettes, and the heated tobacco product. Number 1 was the e-cigarette. So this means that probably the first time they're getting any contact with tobacco or nicotine product is to the e-cigarettes. And down the line, you see that heated tobacco products are only the first choice, the first time they try it for about 2% of our sample. So this is certainly not appealing to adolescents, at least in our sample of high SES and middle SES adolescents, but it is probably something that they're targeting young adults or current smokers, which goes back to which points to my last line in the graph. You could see that family members using a heated tobacco product, it's about 15% of the adolescents that have a family member using an IQOS. And I refer to IQOS because that's the only one available in Guatemala. Now, I'm gonna take the last few minutes. I wanna leave some time for Q&A. This is how a traditional convenience store in a gas station looks in Guatemala. And I apologize because the lady in the counter is just like touching her nose. This is pre-coronavirus status, so she was not violating any laws. So just take that into account. But just in the bird's eye view, you can see that it's heavily packed with advertising for a lot of things. But then when we take into account how much of this advertising is for tobacco, so just follow me with this animation that I'll do here. So I will point out to the tobacco point of sale advertising, heated tobacco product advertising, which is the IQOS, and electronic cigarette advertising. So that's an advertising for Camel cigarettes, that's 1. That's for the IQOS, right down to the M&Ms, right down from the M&Ms, that's 2. This is right where the point of purchase is done. That's for Capsule cigarettes, that's 3. That's 4, that's for Vibe. That's the most common electronic cigarette advertised or available in gas stations in Guatemala, that's 4. That's 5, that is actually the Vibe, where you can see more information on the Vibe. Right next to candies as well, you can see the Lucky Strike right on top of the Vibe. This is for Capsule cigarettes as well. You can see the 4 different colors. Oh, just sorry about that. In the Vibe, right down here where the point of purchase is done, it's right at the eye level of adolescents or kids. This is not targeting adults. There's no adult who's going to approach a cashier and look down at that eye level. So this is definitely targeting kids. So that's 1, 2, 3, 4, 5, 6. That is called, that's right on top of the power wall. You can see all of it as actually for Capsule cigarettes, and ultimately you will see the cigarettes, which most of them in Guatemala at least are Capsule cigarettes. So just in that small space, right in a convenience store, you see 8 marketing strategies at the point of sale. most of them for capsule cigarettes. And then you see IQOS and Vape, even though they're not using advertising or billboards, they are using product placement. Most of these products were less than 50 centimeters away from confectionery, which that stands for the M&Ms, the Snickers, and other candies you can see nearby, as including eye level, as you can see for the Vibe E-Pen in front of the salesperson. So through funding with, in collaboration with Joanna Cohen and the Institute for Global Tobacco Control at Hopkins, we got some funding to go and look for convenience stores in gas stations and survey 30 in a high income neighborhood, 30 in a middle income neighborhood in Guatemala City. And then we went to the second largest city outside of Guatemala City, which is Quetzaltenango, which is the fourth column that you see in the table that's in front of you. You see that actually all of the convenience stores we surveyed have capsule cigarettes and e-cigarettes. In the city, in the high and middle SES neighborhoods, nearly all of them also have e-cigarettes and IQOS. However, e-cigarettes and IQOS were much lower prevalence in the city outside of Guatemala, outside of Guatemala City, the capital of Guatemala, which is telling us something about the market penetration going from the big city, the main city in Guatemala, where most of the purchasing power is, and then reaching out to the second largest city, which probably is going to take some time for the product to get over there. And then you can see some more about store with interior ads. Again, I need to highlight that, yes, we found some interior ads, but these were mostly for cigarettes and capsule cigarettes. But for the electronic cigarettes and the IQOS, they're not using ads themselves per se, but what they're using is product placement, which is what you could see in the 2 or 3 lines at the bottom of the table. You can see that both e-cigarettes and heated tobacco products, the IQOS, are being strategically placed in the point of sale, but also close to confectionery in order they can reach, they can grab the attention of adolescents and children. It is not only about product placement. You can see in your far left, this is an ad, a point of sale ad for Marlboro, which is not a capsule cigarette. This is just the traditional Marlboro Light. It is noteworthy that you do not see the brand Marlboro anymore. You just see the traditional logo, which we all recognize, even though it doesn't say Marlboro. And then down there, you can see a pack of the Lucky Strikes with the 4 different flavors. As I said, and I insist, less than 50 centimeters away from Snickers candies. Next in the middle, you can see the IQOS advertising. Again, this is not a billboard. This is not an ad. This is the product itself, the heats in particular, which are the rechargeable tobacco that you will plug into the IQOS to vape, to smoke it. Again, from confectionery, both peanuts and candies and Halls and Snickers and so on and so forth. The other strategy that they're using in these convenience stores is setting up tables, because most of these convenience stores have hot dogs and sandwiches and ready-to-eat foods over there. And you can see in these tables, they're having the Camel cigarettes. Again, as you can see, the 3 different colors is because they represent capsule cigarettes. So let me start closing with some conclusions. Unfortunately, the Framework Convention on Tobacco Control, it's an evidence-based treaty that in countries that have implemented most of the articles have witnessed considerable progress in stopping the tobacco epidemic. So it is likely a missed opportunity for Guatemala. And I quote missed because maybe you can do something about it still. It is not only about approving a law, but also about law implementation and enforcement. And I think in countries with weak governments, such as Guatemala, I think this is particularly relevant to highlight. The new products are particularly appealing to adolescents, specifically electronic cigarettes that we saw from the data we're collecting with adolescents in Guatemala. We don't know exactly how heated tobacco products are being used in Guatemala, but just anecdotally, it seems that they're reaching out to adults and current smokers that want to switch to a healthier product. Now, how to regulate these 2 new products, electronic cigarettes and heated tobacco products? I think the ball is still out there. We can talk about restrictions or a complete ban. Definitely, we need to talk about flavors, but not only flavors, but also the colors as they're being used as a marketing strategy, both in the name, but in the labels as well. As you saw in the pictures or in the photographs that I showed, these are very fancy labels and very fancy packs with very appealing colors, particularly to the young and technologically savvy. In terms of marketing, of course, they have gotten rid of the traditional advertising strategies, the billboards, the television, the radio, but they're using the point of sale, which is an old strategy that has now included new products. Now, is it time to act given the current pandemic of coronavirus? I would say yes. Do we have the political momentum? I would say yes. Do we have the political will? At least in Guatemala, I would say no. What it's selling politically now is doing the coronavirus testing. Unfortunately, policymaking has never been something that politicians in Guatemala and probably elsewhere considering something that would give them a legacy or something to get reelected. But regardless, I do think it's time to act. Some acknowledgements. These are just some of our collaborators from these projects, both in Guatemala and in the US and Mexico. They have all been outstanding collaborators, and some of them are still working on tobacco. Some of them have moved on to other health allied professions. Funding, most of the funding comes from International Development Research Center over in Canada. And the adolescent survey that we're conducting right now in students is funded by Fogarty. And then the logos of our collaborators, both in the US and Guatemala. And given the current situations and the current discussion, I think I would just end with this quote from Dostoevsky. So with that, I'm gonna stop right there and entertain any questions if there are. Thank you very much for your attention.
Thank you so much, Joaquin. That was fantastic. And the just the sophisticated marketing that you showed us photos of is incredible. I'll ask people to put your question in the chat area, and I can monitor that and pass on the question. As we're waiting for questions, can I just ask, why do you think Philip Morris has chosen Guatemala for their IQOS release? You showed that, that it wasn't in every country in the region. So do you have any insight into why that might be?
That's a very good question, Joanna. It's a non-regulated market. Politically, it's a very weak system with high levels of corruption, which is sad to say, but it's true. High levels of corruption, very little transparency. Since the 1990s, when Stan and I worked on that project, on the Latin project, we described how the tobacco industry manipulated policies around Latin America. Guatemala has been one of their main focus. And I could say, and again, I'm just speculating here, we're not too close to the US to get in trouble, but not too far as well. We're strategically placed between both continents, North and South America. In Central America, Guatemala is the largest economy. So I think it's a combination of strategies. And I think they have very good conservative right-wing allies where they have been successful in placing specific lobbyists. They also fund a think tank called Fundesa, which has been arguing for even less tobacco regulation.
Great, and there's a comment or a question. Have you seen that PMI is targeting doctors and or teachers particularly?
Doctors, I cannot tell you. I can assure you that they're targeting the media. About 3 months ago, one very good reporter came to me and said, hey, could we do a story on IQOS? And I said, absolutely. So we gave them some data. She did a very good interviews in the field, not only with tobacco control, but also she went to look for the opinions. And the story never came out. And I said, what happened? I said, well, actually Philip Morris came to the director and said, you're not gonna publish something. You're gonna give us a reporter, which we're gonna send to Washington to get trained. And then we're gonna issue something. So I said, okay, the story is gone. About a month later, the report is in the newspaper, very well done. But yeah, in the next page, a 2-page ad, an interview with a Philip Morris scientific director in DC, saying how good of a product this is, how Philip Morris is willing to forget the combustible cigarette market to start get this healthy product. Well, you know, it's, first of all, you can see that Philip Morris is handling the media. But second, it's also obvious that Philip Morris is not going to abandon the combustible cigarette. You saw the amount of capsule cigarette advertising there is. And I don't think this is a strategy to get out of the combustible cigarette market. So I think they're going to go for both. They are going for both.
Okay. We've got a lot of questions here, so maybe I'll keep on going. Maybe just related to that before I move to a slightly different topic. Can you comment on the strength of civil society in Guatemala, you know, to counteract this and or to be influenced by these companies?
I think that's coming. I think Beatriz Champagne is in the audience there. Beatriz remembers about 15 years ago when we had a very strong civil society movement, in part funded by American Cancer Society. And we were the second or third country in the Americas to pass a comprehensive smoke-free law that would go exactly where FCTC was aiming to go. We were actually the second country in Central America, the third in the continent. Since then, nothing has moved with civil society. So unfortunately, we have a very weak civil society. The Ministry of Health has a commission for the control of NCDs, which is well-intended, but with absolutely no power to balance the discussion towards the tobacco control side. So I think that's a huge handicap that we need to work on.
Yeah. One of our participants mentioned, and this is an area of huge interest to me, the strategy of PMI to use colors for their heats instead of flavors, specifically. Can you speak to that? Do you have any idea of how people are interpreting the colors, like at these parties that you showed us pictures of, or people sort of understanding, like do they see purple and see that as grape, or red as strawberry, or full strength or something? Any sense of how those colors are being perceived?
You know, Joanna, I think that's a very good question, and I think that needs to be taken, because what we want to get out of here is just some lessons that we can learn, just boring data. And when you see legislation, is usually targeting names, removing the name menthol, removing the reference to flavors. And yes, I think this is good, but when you see what they're doing, the hits, the name of the color is very little. It's the color of the pack what it's appealing. Likewise, for the capsule cigarettes, it doesn't say what 4 flavors you're gonna get. It's the colors where they're targeting to. So I think we need more research on what are the colors and how they're working. We are actually, in this project, we also have a discrete choice experiment, which couldn't get into it, but definitely they're using the color, the product type. You know, if you see an IQOS, it looks like it's a very fancy thing. It's looked like a small cell phone. So I think they're going to product design and the colors. Now, how we regulate that, I think we urgently need more data, and not the traditional data, epidemiological data that we're used to doing, but marketing experts to tell us this is what the colors we are referring to. And Jim Flasher has also done some research on, even if the pack would say, let's say cinnamon, sometimes the vapor will not taste cinnamon, will refer to another taste that he's getting. Even though it's not cinnamon, he likes it. So I think we have a lot to do here in terms of how to regulate these flavors without forgetting the colors and the product design.
Yeah, thank you. One of the questions that came in was about whether you have information on the brand or market shares of the different types of e-cigarettes and heated tobacco products available in Guatemala. I guess to have an understanding of, are these the major multinational players or other major companies, or is there a lot of like smaller companies selling their products?
That's an excellent question with a very challenging response. this is such a fast moving target that the product that we found today might not be out there tomorrow, or might be there tomorrow with a twist, or with a different flavor, or with a different battery. So the product is it mutates, if I might, well, not nowadays for COVID times, we could use mutate. It mutates so fast that we need a lot of money and very good surveillance systems to say where the product is and what type of product we have and how people are using it. It gets more complicated when you see that people can mix the liquids or add or remove things from, I don't think you can remove things from the liquid, but you can certainly add to the liquids. So I think we're actually, in this project, we're going to purchase some e-liquids and e-cigarettes to analyze what's in the product. And it's quite a challenge to decide when to buy them and where to buy them. Now, because of the quarantine in Guatemala, you can not go to malls. But if you go to Uber or Glovo or Ugo, which are the delivery systems, the first thing you see, they will deliver IQOS or Vibe, the electronic cigarettes. So how do we track a product that is so hard to track? And by the way, it's legal, because if it be illegal, you cannot say, okay, let's go to the police or whoever enforces illegal products in the country. But it's a very good question that I think funders and researchers need to be paying attention to.
Great, thank you. There's another question that sort of draws on data from Colombia, from focus groups. And it sounds like they've found that, I guess it's, I think it's focus groups among younger people. And it seemed like they found that IQOS was more, I guess that the participants felt that it's more difficult to hide, and it also, I guess, a bit because of its size and also a distinctive smell. And that might be a factor that might be discouraging use among younger people, as well as price, potentially. So I guess, again, do you have any thoughts on that from a Guatemala perspective?
I think, unfortunately, we don't have the qualitative data that Colombia has, because I think the questions need a different approach than what we're doing. We're doing the traditional epidemiology Q1, the survey, right? But I think through focus groups, I think we need to get to that questions on why our adolescents are not using it. My gut feeling would be price, but I think our colleague from Colombia is right that it's more expensive, yes, but it's also bigger. It requires that you buy the cartridges, then disposing it, although it has its own trash can, the little container in the IQOS. So I think there's several issues why it's not popular among adolescents yet. I think as the product evolves and penetrates the market and they manage to bring the price down, it might become more common among adolescents. But I also think it could be due to, they only have 5 flavors or colors, however you want to call it, as opposed to e-cigarettes that you have a huge amount of flavors and colors. So I think there's a lot we still don't know about why this product has not penetrated adolescents yet.
Yeah, and you may be right. It might just be a matter of time. I mean, with all that advertising at the point of sale and the sponsored events, the parties for young adults, you know, it could certainly trickle down with just a bit more time, for sure. So in terms of the different, e-cigarettes versus heated tobacco products, you didn't mention one of the infamous brands of e-cigarettes, which is Juul. Did you see, is Juul being sold in Guatemala?
No Juul yet. Vibe is pretty much Juul. It's the same thing. It's different. It's a little bit shorter, but thicker, but no Juul in Guatemala yet. And I think it's interesting because most of the regulatory process in the US is around Juul, even though you find other e-cigarettes. But in Guatemala, we don't have any Juul yet. I think it might be a matter of time. As a matter of fact, Jim and I think that in the second round with the students, whenever we can do it, because the schools were closed, we're probably it's very hard to tell given the current quarantine, which is affecting businesses as well. But I think it's a matter of time until we find Jewel here.
Okay, great. I think there's one last question which is a great one to end on. So can you tell us if there are any plans in Guatemala to regulate e-cigarettes and heated tobacco products in the future? Are there any discussions? I know you said that civil society isn't very strong, but do you think, is there any sense that this might happen, or it's just off the table completely at this point in time?
So this is, and I think this is why Guatemala is an interesting experiment. Guatemala is known for being a lab for the rest of the world. So if we were to choose either going after the FCTC implementation, which is evidence-based, established laws that we should have implemented 15 years ago, and now start chasing heated tobacco products, electronic cigarettes regulations, where do we put our chips in with such a weak civil society? And unfortunately, I cannot answer the question. It's a very complicated scenario. To answer the question straightforward, no, there is no effort to regulate neither ENDs nor HTPs. Now, if you were to say, okay, here's $50,000, go after tobacco control or after the epidemic in Guatemala, where do you put your chips in? It's a very complicated scenario. And I think if things keep going this way, it's gonna get even worse as we get new products into such unregulated market.
Yeah, and you showed us the table near the beginning of your presentation with like all the evidence-based policies and whether they're enacted yet in Guatemala, and there were mostly no's. So as you say, there's a lot of work still that needs to be done, and even on basic things like smoke-free public places, etc. So I just want, there's a lot of congratulatory remarks in the chat, and thanks for your excellent presentation and very informative, and I'd like to add my thanks to that, and really appreciate you spending time with us today from your home, and giving us a really comprehensive view of what's happening in Guatemala on this important topic. So thank you very much, Joaquin Barnoya, and thanks everyone for joining us. And we will be posting a video of this presentation on our YouTube channel at globaltobaccocontrol.org in the coming days. So thanks everyone. Have a good rest of your day, good evening, and stay well. Bye-bye.
Thank you, Joanna. Everybody take care. Bye-bye.
Thank you, Joaquin. Gracias.
Un abrazo. Chao.
Chao.